My name is Vinod. I live in St. Paul, Minnesota. I have glaucoma, uh, very severe glaucoma that is likely caused by oral steroids given to me after a previous eye surgery. So this glaucoma has progressed to the point where my central vision is affected and I am legally blind. I don't have vision in the other eye, so I have vision in one eye, and that acuity is 20 on 200, which makes me legally blind. So I cannot read because reading requires central vision, and my profession as a college professor requires me to read. I think I came here after hearing about Dr. Yu in spring 2023, and at that point the vision, the blind spot was pretty big. And over the last 6 visits, that blind spot has progressively shrunk. As a result of the loss of central vision, I had to stop driving. So every time I come here, I stay for usually 2 weeks, and it takes maybe my second day before I start seeing a difference in vision. I guess every person responds differently. So the change in vision I can immediately, I can see sometimes right after an acupuncture session, when I'm comparing, when I'm constantly observing what I can and cannot see, and so I can tell the difference before and after the session. And the blind spot, I think my central blind spot last year was covering an angle of something like 20 degrees, and now as of today I am myself measuring something like 4 degrees on one side and 8 degrees on the other. So to illustrate, this was how the blind spot was. So that's the central axis, and all around it, this whole thing is my field of view, and the shaded area is the part that I could not see. It was sort of gray, and it is now October 2025 instead of 2024, and this is how my blind spot looks now. The angle of vision subtended by the blind spot has shrunk on both sides, and it leaves this axis angled, inclined axis that still remains, but I'm seeing a difference even in that today. Even the extent of that has shrunk. When if I can keep observing what, this is sort of like a visual field test. I can do it myself without needing lights, and tells me very clearly what progress there is. So yeah, every time I come in, there is some change, and sometimes it's dramatic, and sometimes it's subtle, but there is improvement almost every single time. Yeah, so because central vision is responsible for reading, while peripheral vision lets us, move around. I can detect stairs. I don't trip or fall down stairs, but central vision affects reading because letters subtend a very small angle at the center of our eye, and so without central vision, I cannot read, which is important for my profession, most professions. And earlier, I could not even see that there was font on the page. It was because the blind spot was so big. Now I am able to read font that is extremely large. I mean, I think today, for example, I think I was reading probably 36-point font, which I could not earlier. I could not even see 36-point font earlier. So that is a dramatic improvement since the last time even, I think. So I think it's important to be a hopeful person. I have generally been optimistic about most things, and that somehow affects the treatment as well. So, but certainly the treatment itself gives hope because you can see the steady improvement and you don't feel um, um, you don't give in to despair because there is clearly something that's slowly improving your life. Um, it is, it's possible for Western doctors to say, look, we are going to monitor how your eye declines, and there's in case, I have glaucoma, but there are diseases like retinitis pigmentosa where there is no known cure, and the only option is to watch a patient's vision decline, and in such cases, it is even more so that the patient really is given some kind of hope, and that really improves how people experience life. Well, from a scientific perspective, we are talking about two completely different philosophical systems. I don't think one can evaluate the other that directly because the assumptions are based on completely different things. Um, so, but empirically, one can see that it works. Why it works is not something that one system can easily analyze using the assumptions of that system. But I think the data seem to suggest very clearly, all the people I meet at the clinic, it's very clear that they are seeing improvements in vision. That's undeniable. How one explains it is a whole different story. So certainly there is something in traditional Chinese medicine with the right practitioner that it works, because traditional Chinese medicine, I have also seen other practitioners in other cities where I saw absolutely no difference. So it's because it's not such a protocol driven system, where it really depends on the observational skills of the particular doctor, and who tries to tailor the treatment to the particular patient. um, Results can vary, and I think I've seen that in this, with TCM, but with other practitioners, not Dr. Yu, where the results were not very uh, confidence building. Yeah, I don't think it makes sense to be hopeless because Dr. Yu seems to know, he really thinks about what he's doing. He's tailoring it for every single patient clearly. And so I think there is definitely hope, um, at least with Dr. Yu. I don't know about other practitioners, but he seems to have a really deep understanding of TCM that helps him heal patients, especially for RP and glaucoma.